Okay, we're going to take a look at the muscles on the scalp, on the face, and down along the anterior neck. We'll start with the expressive muscles. So first one you're going to want to identify is going to be this muscle up here, which is going to be part of your epicranius muscle. So that one's going to originate on the frontal ridge or the supraorbital ridge, and it's going to come up and over the head all the way around to the occipital bone. Now we can see the anterior segment of this muscle, which is going to be the frontal belly, sometimes called frontalis, and you can see right here where the contractile fibers are going to stop and they become connective fibers here. So this muscle is segmented. This would be the anterior segment. Then you'll have some tendinous tissue here, and then the posterior segment is going to be way back here on the occipital bone, which if we pull this off a little, you can see a little bit of the muscle fibers here. It's not a real clean picture, but this would be where the occipital belly would be there. So this is a strap muscle that goes from the frontal bone around to that occipital bone. If you contract the frontal portion of it, that would raise your eyebrows up. If you can contract the occipital portion back there, that may move your scalp posteriorly. It may wiggle your ears. It might do a combination of those two things. That'll be the first one. Epicranius, again, frontal belly, occipital belly back there. Next one we're going to find is here around the eyes. This will be called orbicularis oculi. And that's going to be a circular muscle. It's going to surround the eye socket. And what this one will do is, because it's a circular muscle, this is actually a sphincter muscle. So the muscle fibers, they make a loop and they connect to each other. And when that loop contracts, it gets smaller, right? So you're going to close the skin over the eye there for orbicularis oculi. Now we have another muscle around the mouth, which is called orbicularis oris. Now this one's not going to be able to be seen quite as well. You can see a couple of the muscle fibers here kind of going side to side, a little bit maybe not so good up on top of the mouth, but it'll be here. But we can just kind of show the outline of it. It would be in this direction here. That'd be orbicularis oris, and that one would close the skin around your mouth. It wouldn't actually close your jaw. It's not going to move the maxilla up towards the mandible, but it'll close the skin around the mouth opening there. Next one we want to find is going to be the two of your smiling muscles, and that's going to be this one here, which is called zygomaticus major, going from the corner of the mouth up towards the zygomatic bone. That'd be that one. And right above it, and we have an example of it here, would be zygomaticus minor. And it's just going to be this band right here, which is still going from the zygomatic bone, and this is coming over and going to come around to the top of the lips here. And it's actually going to anchor into orbicularis oris. So is zygomaticus major. So zygomaticus major, zygomaticus minor be there. The next ones you want to find are ones that are going to raise and lower the corners of your mouth. So we're going to have one muscle that's going to start here, and I'm just going to outline it like this. It's kind of a triangular shaped muscle. It goes from the bottom edge of the mandible up to the corner of the mouth. That one is going to be depressor anguli oris, going down that way. And then we're going to have this one up here, and let's just going to move the cheeks down a little bit, which will stretch this one out. And we can see this muscle here. So it's going from the corner of the mouth straight up this way, and it's going to attach into the maxilla. That one is going to be levator anguli oris. So these muscles move the corner of your mouth down or up. The next muscle we want to see will be over here on the side of the nose, and this picture is okay, but we can see a little bit of muscle in this area with the fibers going in that direction there, and that's going to be called nasalis, and that one will help flare the nostrils. And the last expressive muscle that we're going to see will be down here on the anterior neck right here, and that one's called platysma. You can see we can hold this muscle up a little bit like this. It's very thin. It would cover over one half of the anterior neck there. And when you contract that muscle, it basically just tightens up the skin on the anterior portion of the neck. So that would take care of the expressive muscles that we're going to see. The next thing we want to look at would be the functional muscles. And we'll start with the functional muscles up on the face here. First one will be one that's going to be located up on the temporal bone. So we're going to take this piece of fascia, we're going to peel that down, and then we're going to take this piece of fascia, we're going to peel that one down as well. And once we get that off of there, we can see this muscle exposed, which is called temporalis. And that muscle is going to cover over the temporal bone here. We can see the direction of the muscle going down this way. It's going to pass underneath a bony ridge that we can feel right along here called the zygomatic arch. And that muscle is going to come down under the zygomatic arch and attach to the coronoid process of the mandible. Now that process is covered, get that out of there. That process is covered by another muscle related to temporalis, which is called masseter. Masseter originates on the angle of the mandible down here and comes up towards the zygomatic bone here. So temporalis and masseter, both of those are chewing muscles. They're both going to cause you to close your mouth. And if we take masseter here and I've detached it, and we can move this muscle out of the way a little bit like that, and holding masseter out of the way now, we can use a probe and we can pass underneath that zygomatic arch. And right there where the probe is ending is where temporalis attaches to the coronoid process of the mandible. So again, that's covered typically by masseter. So we just peeled masseter out of the way so we can see that passageway back there. So those two muscles would be muscles we use for chewing, temporalis and masseter. Next muscle we want to see in this area will be one called buccinator. Buccinator is located in the walls of your cheeks. So if we just push the probe in here and I'm pushing against, you can see me moving the cheek out there, that all of these muscle fibers that you see all along here, that's all part of buccinator. So again, this muscle embedded in the walls of your cheeks. The next muscles we want to take a look at are going to be the functional muscles down in the anterior neck. So we're going to take platysma and we're going to reflect that up over the face. And the next muscle that we uncover here would be this one, which is called sternocleidomastoid. So the name of this muscle corresponds to its attachment points. So the sterno part would attach to the top of the manubrium. The cleido part would attach to the clavicle. Now you can see that the clavicle is cut here, and here's the piece of clavicle that we took out. So it would attach along the clavicle. That's the sternocleido part. And then if we follow this muscle up towards the skull, back here, it would attach to the mastoid process of the skull. So that's where the muscle gets its name from, its three attachment points. If we take sternocleidomastoid, this muscle, when it contracts, if we have a bilateral contraction, so if we're going to pull both sides like this, now this muscle, remember, attaches behind the head here. So when both sides contract, it's actually going to tilt the head back. You're going to get extension or hyperextension of the skull. If we have a unilateral contraction, just one side pulls here, part of it's going to act vertically, and that's going to give you a lateral flexion of the skull, so the head's going to bend towards that side. And the other way is going to give you a horizontal action, which is going to go this way. And if we grab the ear and we pulled it this way, this muscle on the right-hand side would cause the face to rotate to the left. So that's going to be an opposite side lateral rotation. So that would be the functions for sternocleidomastoid. So we're going to take that muscle, we're going to reflect that one out of the way. And before we can do the rest of the muscles here on the anterior neck, there's a couple other things that we need to identify. First, we have a nice example here of some anterior jugular veins. So just cut those and we're just going to reflect those out of the way. So we're moving some anterior jugular veins out of the way. And next thing is we need to identify some of the bony and cartilage structures here on the anterior side of the neck. So if we start at the tip of the mandible and we trace straight down along the midline of the anterior neck here, we're going to run into a couple of bony spots. First one here would be the hyoid bone. That's going to be right in this area here, and it's horseshoe shaped. So we're feeling the top of the horseshoe.